I'm Sandra. I'll be presenting with Noah and Elizabeth on Nano Medicine. Okay, so we'll be starting by talking about the introduction. Do this. Nanoscale, nanocarries, advantages and disadvantages in nanomedicine, drug delivery system, application. The first successful in the nanomedicine, diseases that can benefit from the nanomedicine treatments, nanoparticles in nanomedicine. What's wrong?
Yeah, the print is too small to.
Oh.
We're just turning on those.
I think you have to turn these on before you turn everything else on.
No, it's like this one.
See it, turn it off.
Do you need that? No, it's not. That doesn't matter.
Okay, sorry.
Okay, nanoparticles in nanomedicine, gene therapy, surgery, cancer treatments, tissue repair and replacement. Nanobots are the future, and we'll be ending with the conclusion. I'll now pass it off to Noah for the introduction.
So imagine if we could treat diseases without any complications and any unnecessary drugs. So nanomedicine is a combination of engineering, biology, and nanotechnology at the molecular level for curing diseases and repairing tissue damage. So with the aim to improve comprehensive monitoring, control, construction, repair, and defense, it will improve all human biological systems. So nanomedicine works by injecting nanoparticles into the body, so it can be used to deliver medicine.
Do it as a mom. You can stand it up.
Yeah, that.
No?
There we go. Okay, so nanomedicine works by injecting nanoparticles into the body. It can be used to deliver medicine, repair damaged cells, and treat diseases. So with the end goal being to improve diagnostics, treatment, and prevention. So here depicted, we have inflamed colon. So with the classical drug, it can be administered orally or by injection. So then it's going to disperse all into the body, treating the inflamed zone and healthy cells. With nano drugs, it's only administered orally, and it only goes to the inflamed colon, nowhere else in the body. And here we have a nanoscale. So the nanoscale will help nanomedicine with involving design characteristics, portions, and materials and devices. So it's all going to look different, but it is going to be in a range of 1 to 100 nanometers. So a nano indicates 10 to the power of 9. A nanometer is 10 to the power of 9 meters. So take in representative, the human form is about 80,000 nanometers thick. So here we have on the figure, we have 1 nanometer, which is a molecule, and then a DNA is 10 nanometers, and then 100 would be for a virus. So with nanotechnology or nanomedicine, it will only ever vary in this scale. Then we move on into 3 major applications of nanomedicine. So we have diagnostic application, therapeutic application, and research application. So the first with diagnostics, so medical diagnostic, it will help improve faster diagnosis of diseases. It will detect the disease at an earlier and faster stage. So this will help with imaging agents for cancer diagnosis and for infectious disease diagnosis. So this would work by using nano-sizable metal oxides and then also quantum dots. The quantum dots would then be a non-invasive medical imaging technique and tool to help. So then we move on into therapeutic uses. So for therapeutic uses, it's going to be in various fields, such as cancer therapy, regenerative medicine, we're going to have imaging, immunotherapy, and then the unique properties of nanoparticles can then be harnessed and enhanced with the therapeutic uses in more efficacy and safety conventional therapies developed for various diseases. So with the therapeutic applications, it can treat infections and non-infectious diseases. It can be used for cancer treatment, gene and stem cell therapy, and regenerative medicine, tissue engineering, and prosthetic orthopedic implants. So here we have the research uses. So with the new research that's being generated, they have created a lock, which is a lab on a chip. So the lab on a chip is the size of a postage stamp. So it's already commercially available and in use. So it monitors lithium medication for people who have manic depressive or disorder. So those are the patients that it is used for right now. So the future development will be that law will offer faster and more advantages for precise analysis of use. Then we move on to advantages and disadvantages of nanomedicine. So let's say we have our arteries are blocked. So the drug delivery will be to the exact location of our arteries. It would be less side effects to that. It would be more efficacy would be higher, so it would target the exact spot. Molecular targeting of the nano engineered device would then be there. It would detect and diagnose at an earlier stage. No surgery would be required. It would just alter the block, and then diseases can be easily cured, and then longevity in your life. The disadvantages is that it is costly, it's not practical yet, and implementation difficulties could arise during. So I will pass it on to Sandra.
So nanoparticles. Nanoparticles are defined in 3 different ways: by their physical properties, the structure, which is their chemical composition, and the targeting ligand. Their physical properties include the size, the geometry, the surface charge, the porosity, the elasticity, and the stiffness. And then the structure, the chemical composition, depends on their liposomes, the polymeric MPs, which are degradable and non-degradable polymers, micelles, dendrimers, protein MPs, viral MPs, exosomes, and natural membrane MPs, and metal and non-metal derived MPs, and so on. And then their targeting ligands are the, and then the targeting ligands depend on the small molecules, the antibodies and fragments, the aptamers and nucleic acids, and the protein and peptides along with the sugars. I'll now pass it on to Elizabeth to talk about nanocarriers.
Thank you, Sandra. So nanocarriers are classified into 3 different categories based on the material that they are made from polymeric nanocarriers, lipid-based, and inorganic nanocarriers. And as you can see, the 3 different categories on this diagram, with the polymeric nanocarriers on the top, polymeric nanocarriers are synthesized from different types of natural and synthetic polymers that generally have a good biocompatibility and biodegradability. The advantages of these polymer nanomaterials compared to other nanocarriers include stability in various microenvironments, slow release of drugs due to polymer degradation, and their diversity in the type of polymers and types of drugs that they can be encapsulated with. The properties and prioritize nano nano properties can be beneficial for the treatment in several potential fatal diseases occurring, such as cancer, neurodegenerative diseases, cardiovascular, and viral infections. In lipid nanocarriers, the liposome was the first nanotransmitter to be clinically approved by the FDA for chemotherapeutic drugs in 1996. The lipid-based carriers allow therapeutic load to be directed to the deep layer of the skin and blood circulation. And inorganic nanoparticles, which may consist of iron oxide, cilia, or gold, among various other compounds, due to their low biocompatibility, lack the understanding and possible complications with the organs. And with with the inorganic nanocarriers, gold nanoparticles are studied and are a very important mechanism for drug delivery and demonstrating better tumor targeting than the other ones, and thus reducing the use of the amount of drugs, and there's less adverse effects to those types of carriers. Moving on to application. Yes. Moving on to application, the diagnostic is used for imaging and identification, and therapeutic it's used for delivering medication to the exact location, killing the bacteria and viruses and cancer cells, and repair of damaged tissue. And that can be used via smart pill, nano drug delivery systems, regenerative nanomedicine, and cancer detection and treatment. And the first successfully utilized nanomedicine, while there right now there's only been 2 that have been approved by the FDA. The first one was Doxil, a liposomal formulation of doxorubicin, and that was first approved in 1995. And in 2005, the albumin-bound paclitaxel formulation of Abraxane was approved, and that was largely by virtue of the reduced side effects in the treatment of solid tumors. Thank you. And with the drug delivery systems, drug delivery is used nano devices specifically targeting the cell to guide the delivery of drugs, proteins, and genes. And the drug delivery uses that are used are dendrimers, nanocells, liposomes, micelles, quantum dots, and nanocrystals. And
Okay,
then
so
I
as
will,
for diseases that can benefit from nanomedicine treatment, we have cardiovascular diseases, neurodegenerative diseases, diabetes, infectious diseases, cancer, HIV, and AIDS. As for gene therapy, the cons of in vivo would be it's a less invasive procedure. It directly tackles proliferative tumor cells, which inhibit cell division. The cons are they depend on the vector. They require targeting of tumor cells, and possible immune responses are given to gene vectors. Whereas ex vivo, the pros are the selection of the target cells, the immunocompatibility of autologous cells, and it requires the cons, I should say, are they require an invasive procedure for solid tumors. They are non-proliferative altered tumor cells, and they won't outgrow over highly proliferative tumor cells. As for surgeries and nanomedicine, surgeons are constantly looking for ways for minimally invasive ways to treat their patients. Recovery is faster when there's less trauma that's inflicted upon the patients and fewer complications in the aftermath of the operation. The potential of applications of nanomedicine within surgery is nanobots. So nanobots would be controlled by a surgeon using a computer that can perform precise surgeries within cells, which humans aren't capable of scaffolds that are thousands of times larger in a single cell. So a few examples of surgery in nanomedicine would be nanoimaging, nerve and tendon engineering, wound healing, bones and cartilage regeneration, machine perfusion therapy, and transplants and nanosurfacing.
and in cancer treatments, nanomedicine can be used to target cancer cells and deliver therapeutic agents such as chemotherapy drugs, gene therapy, photodynamic therapy, and the targeting ability of the nanoparticles can reduce the side effects associated with conventional chemotherapy or cancer treatments.
Tissue and repair replacement in nanomedicine. So natural and synthetic scaffolds have been tested in order to produce a clinically useful tissue scaffold of a target tissue or organ. Examples of natural scaffolds have been clinically applied, including decellularized dermis to treat burn injuries, as well as decellularized small intestine, uterine, or xenogenic vessels to restore vascular function. They have some drawbacks regarding mechanical properties, degradation, immunogenicity, and cross-contamination. And this graph here is just showing the annual healthcare costs of tissue and repair replacement. As we can see, heart is the highest cost, whereas skin is the lowest cost annually.
And nanobots are the future vision. Nanobots are used to detect and repair targeted damage and infections with the body. They are a biomedical instrument that are used in nanosurgeries. And while scientists have been researching nanotechnology for decades, they are just beginning to unlock the full potential and the capabilities of nanomedicine and they can offer the healthcare industry. And hopefully in the future, this can offer more economical, convenient, effective, and safe ways of treatment. In conclusion, nanotechnology has led to a medical renaissance. The full potential of nanomedicine may be years away and something to look forward to with the continuous advances in nanotechnology related drug delivery, diagnosis, and drug development are beginning to change the architect of medicine to this day.
For our sources, and then any questions?
So I have a question regarding. So I have a question with regard to things like, the diabetes patch that they use and those solar patches they put on your back when you have pain in your back to relax your muscles. Or I'm trying to think of some of the things that we're just now seeing out, especially with insulin wearing your device. So is that nanomedicine in practice, or are we not really there, other than, I know there's a lot of use in cancer, but how close are we to actually seeing outcomes, results for the everyday common person?
I think that's gonna take a few years just because it's new, it's still, I think that most of the research has been just within like cancer and like injections and all that, but we didn't find much on diabetes, so it's probably gonna take within the next few years, I would say.
And then each thing that comes out has to go through the FDA for approval as well.
Right.
So it could be decades before something this cutting edge could actually help. So I won't be around at that time. There's so much to their idea saying that.
I think within the next few years.
So then, yeah, I was just gonna say, so is this more like the other one we heard last week, more like bioengineering? Are physicians leading this way? This is a scientist, right? So a scientist would have to figure out how to apply it into medicine. So that's not really gonna happen unless it's MD PhDs, right?
It's incorporating engineering.
Or scientists, anybody.
Yeah, any bioengineers, that's mainly what it's including, engineering, nanotechnology, and then scientists, so it's like all in one, they're working together to get this, so everyone's doing their different parts to create the nanobot.
So it's gonna come from some major university. And then are there bioengineering companies that the average person could invest in for the potential? How is it getting funded, or is it all funded through like NIH grants and things like that, like regular research?
It's looking like it's being funded through research just because as we were doing our research, that's what,
We found,
yeah.
Mostly.
that's the. NIH.
So you're talking, I mean, I'm sure MD Anderson has a ton of it, I mean, that's what I'm thinking. It's gonna have to be some huge organization that's into a specific disease. Okay. I'm just wondering, if anything, I would think that something that could be so efficient, so easy for humans should be quick. I mean, we're all going through all of these COVID testing and all these inoculations and vaccines. The truth is, we could have a patch. You know, and the patch would keep us healthy all the time.
Yeah,
Something to raise the immune system's function
Yeah.
during these outbreaks, like flu season or pandemic. Is what we need is something that could easily be done. So that's why I'm looking for, the nicotine patch to get people to reduce their cravings. These are kind of simple things, but they're using the skin as an organ and then letting it go into the body at a regular rate or a constant rate. So can we bring it down to something practical for the everyday person?
my question is, did you see anything while you were studying on the moral and ethics issues around people getting, like you mentioned, lithium for a bipolar patient getting a chip on?
There was, yes, people weren't happy with that. They were saying it's gonna cause other disorders as well. Or that's what I was reading, but nothing.
Or what about the fact that they could use it, it could be hacked if it's a chip? Right?
Yes, it could be active. Yeah.
Or what if it could be used for surveillance, not just for treatment?
So I'm sure they're probably.
So that's one of the United States phenomenon, that they have Sweden, they're already using chips. And in Ibiza, which is an island off of Spain, they've been using, some young people have been inserting chips to be able to get into the bars. Not for any medical reason.
That I do not know, but
It's those chips are becoming quite.
So
popular.
does anybody have any more questions for this group? Because I want to use this group as a teaching moment for you guys moving forward for presentations, because most of you still have one semester left with me. So I wanted to say this. So your presentation was very good, the PowerPoint slides. You addressed every PowerPoint slide. You can't use a PowerPoint slide and not address it. That's one thing. I've seen that in last week's presentation. So if you don't understand what you're putting up, don't use it. Right? That's one thing. Some people let their nerves get a hold of them. So like you notice that Noah, if you talk to her in the hallway or one-to-one, she's very relaxed. Every time she does presentation, her speech gets pressured.
It's faster and faster and
Right.
faster.
Don't run through it because you're helping you're among your friends and you're doing a service to other people. You're teaching them something that you've reviewed, that you took time to put together, that you're all who are going into medical, dental school, PA school, whatever it is, even pharmacy, which is very big with nanotechnology, right? So just like go slow. I like the fact that they introduce themselves. So yes, if I'm giving a presentation and Dr. Eccles is going to do the next part, I say, and Dr. Eccles will be covering so-and-so. The next topic, right?
And the
What?
transition is smooth.
Yeah, I like that. And then, of course, presentation is everything. Like the fact when you're presenting something, dress up for it. Do you have any other feedback?
I would have liked to see the print on the PowerPoint slide larger. I felt like, I know that I covered with you guys how to do presentations. And the white lettering on the yellow, remember we talked about, the color combinations. You really couldn't see the white print. I mean, nicely, she was reading it. So so I knew what it said, but there again, we're in the learning phase.
Yeah.
This is, we're all making mistakes here and it has nothing to do with your grade. It's just an opportunity.
Yeah, I'm just using this as an opportunity to help you in the future, not because of your grade. The other thing is, and I'm gonna be very, you know how I am already, you guys know me, I'm a straight shooter, right? I don't candy coat. In one of last presentation, Kevin was giving me his back the whole time. You don't do that to your audience. All right? You're a gorgeous guy. Stand up and let people see you. What's up with that? You're keeping yourself hiding from us? So you stand up and you have to face your audience, right? No one is judging you. They're focused on, and if they're judging you, you know what? You have no control over that. So whatever you don't have control, you just let it go. So you're here to do a job to present the topic that you've already prepared on. The other thing that I want to tell you is I gave you as part of the assignment to look up 3 research articles no older than 3 years and to include them in your presentation. Not a source as reference, but to get you used to reading research articles and be able to compare and contrast. Look, Joe from New York is saying this. Oh, but Mona from Maryland is saying this other thing, you see? So that I can see how you guys are processing that there's different point of views even within the scientific field, right? What people are discovering, what they're bringing together. Very good presentation. I'm happy with the way you guys presented.
Nano medicine seems like a really cutting edge thing. So, yeah, I'm concerned. I wonder if we're covering those kinds of things in medical school. I'm guessing not.
I don't know
You know,
if they're covering in medical school, but for a year, I want you guys to be the forefront, you know? I want you guys to break, when you get into your careers, wherever you're going, and you graduate from here, I want you to be the ones that break the molds. That make a difference, right? That you impress the doctors, the dentists, the medical, you're like, wow, this student is really on top of it. So yeah, what Dr. F was saying, a lot of your colleagues maybe are not gonna know about nanotechnology. Who was the first person to talk about nanotechnology?
Last week, didn't somebody bring it up?
Huh?
Wait, just in general or like here in the past?
No, no, in
Last-
general.
oh.
Wasn't it the lady who came in the pharmacy?
it
The pharmacist, like?
No.
No?
was in 1995 or 96.
Before that, Ray Kurzweil, he's the one who talks about the singularity theory. Where eventually we're gonna have transhumanism. That's what transhumanism is. Where humans are gonna have chips inserted in them. That's what Elon Musk is doing with Neuralink. To cure multiple sclerosis by putting a chip in your brain,
That's scary to think of.
right?
That's why.
So he was not a medical, Ray Kurzweil is not a medical doctor. He was then later on contracted by Google. Years later, he's one of the scientists with most awards. He graduated from MIT. The guy has everything, PhD, I mean, he's a genius. You should look him up because he's the one who came up with singularity theory in the 80s. Right? I've been following this guy since the 80s. So you should follow him because I mean, they have people that like he's too far out, so he's had a lot of people also, like you're saying, oh, a chip in the brain. But he was talking about nanotechnology and regeneration of organ tissues since the 80s. And he has nothing to do with the medical field.
Your generation, as the healthcare providers, you are the ones that are going to have to deal with the ethics and morality of how invasive into the body system do you want the new era of medicine to be? It's gonna be you guys sitting at the IRB meetings and listening to the ethics and morals of presentations and watching science develop. Science can do a lot of things. But
Good and bad.
yeah, it'll be your generation that has to decide where to put those boundaries and when is too much, you know? Imagine, interesting.
Scary,
Okay, so
very scary.
It's very scary. Yeah.
questions.
And we were worried about abortion and euthanasia. You guys have a whole other agenda you have to learn.
So yeah, like this, you guys face the audience, you introduce each other, you allow for the board to be clear, not standing in front of the TV, so, because then that obstructs, if you're like in the middle of the way, right? Not you, I'm saying anybody else, right? Okay, any other feedback the class wants to give to the students, anything that I'm not seeing that you caught? Good or bad, it's not good or bad, it's anything that could be helpful or that you want to compliment them, that they've already have. Online students, you're welcome to participate.
Compliment them. I think their presentation style was really good, really animated. It engaged me, you know, with what you were saying. It wasn't just, I'm coming up here to just present. I actually was, you know, getting into this new learning, this new subject that I didn't know anything about.
Okay, very good.